Sustainable Duke, the Trent Center for Bioethics, Humanities, and History of Medicine, and the Provost Office through an Intellectual Community Planning Grant. Oops, sorry. A little technical difficulty here. There we go. As we begin, we want to acknowledge that we're hosting this series on the traditional territory and land of the Sappone peoples. I'm grateful to Dr. Emanuel for helping me to frame this, not simply in a distant notion of the past, but recognition of an active connected presence. So as we see here, this is a fundraising run of the Sappone Tribe that supports the Sappone Youth Camp and Heritage Program. And the mural is on the multi-purpose building of the Hollow Sappone Tribe that houses the community's programs, which are all based on the theme of healing. And then the Okinichi band of the Sappone have an initiative to buy back some of the ancestral lands and develop a complex that will include educational purposes. So with that, our guests today are Dr. Ryan Emanuel, Ms. Sherry White-Williamson, and Dr. Annemarie Walton. Dr. Emanuel is an associate professor of hydrology in the Nicholas School of the Environment here at Duke. He leads a group of scholars studying plant-water interactions and watershed-scale ecohydrological processes through modeling and field-based studies. His group also works to amplify Indigenous perspectives on water and the environment. Much of their work aims to identify and address barriers to tribal participation in environmental health decision-making. Dr. Emanuel has received several awards and fellowships related to his scholarship and advocacy on environmental justice and Indigenous rights. He belongs to the Lumbee Tribe of North Carolina. Dr. Emanuel holds degrees from Duke University and the University of Virginia. Ms. Sherry White-Williamson is the Environmental Justice Policy Director at the North Carolina Conservation Network, where she focuses on incorporating consideration of environmental justice in NCCN's policy and outreach efforts. Ms. White-Williamson retired from the U.S. EPA Office of Environmental Justice, where she served in many roles, including manager of the Interagency Working Group on Environmental Justice, established under Executive Order 12898, and designated federal officer to the National Environmental Justice Advisory Council. Ms. White-Williamson holds a Juris Doctor and Masters of Energy Regulation and Law from the Vermont Law School, South Royalton, Vermont. While at VLS, she co-founded the Environmental Justice Law Society. She was also awarded the Mark Mihaly Environmental Leadership Award in recognition of her commitment to the environment and environmental justice. She currently resides in Sampson County, North Carolina, where she co-founded the Environmental Justice Community Action Network located in Clinton, North Carolina. EJCAN is working closely with impacted communities affected by CAFOs, regional landfill and wood pellet manufacturing. In addition, she teaches environmental justice courses at Duke University and OSAB Institute of Environmental Studies in Mansalona, Michigan. Dr. Annemarie Walton is an assistant professor at the Duke University School of Nursing. Dr. Walton's programs of research examine minimizing occupational exposures to carcinogens. Her dissertation work combined her educational preparation and over 10 years of clinical experience caring for patients with acute leukemia to examine the pesticide protective behaviors of Latino migrant and seasonal farm workers. This work was supported by a T32 fellowship in cancer, aging, and end of life from the National Institutes of Nursing Research, an American Cancer Society doctoral scholarship in oncology nursing, and a Jonas Nurse Leadership Scholarship. Dr. Walton completed a postdoctoral fellowship at UNC Chapel Hill School of Nursing. She received support from a T32 fellowship in interventions to prevent and manage chronic illness from the National Institutes of Nursing Research and pilot funds from the NC Occupational Safety and Health Education Research Center for work that focused on understanding the protective behaviors of nursing assistants handling anti-neoplastic drugs contaminated excreta. She has been very active in policy and practice recommendations to improve safe handling of hazardous drugs. Dr. Walton's service work centers on preparing and enabling nurses to lead change to advance health. She was inducted as a fellow in the American Academy of Nursing in 2020. Thank you and welcome. So as we begin, I'll just provide a little bit of perspective of framing. We are interconnected, as you see in this quote by Chief Seattle. Humankind has not woven the web of life. We are but one thread within it. Whatever we do to the web, we do to ourselves. All things are bound together. All things connect. In a recent New York Times article reporting on the latest IPCC report, Ani Dasgupta, president of the World Resources Institute, noted, "Climate change is the ultimate injustice. People with the fewest resources, those least responsible for the climate crisis, bear the brunt of climate impacts. If you don't live in a hotspot, imagine instead a roof blown away, a village well overwhelmed by salt water, a failed crop, a job lost, a meal skipped, all at once, again and again." So we know that climate change is here and it is a crisis. It's deeply interconnected to health in complex, multidimensional ways. This slide illustrates the most significant climate change impacts, such as rising temperatures, more extreme weather, rising sea levels, increasing carbon dioxide levels, and their effects on exposure pathways and the consequent health outcomes. Here we take a step back further and see the added complex, inextricable interconnections from a planetary health perspective. Note that climate change and health are parts of a much more complex system with multiple drivers. This webinar series seeks to reveal the connection between climate change, health, and social justice more fully, with an aim towards engaging in collective solutions for addressing this communal crisis. We thank our speakers for sharing their expertise with us today. Our first speaker will be Dr. Emanuel. Welcome and thank you.
Thank you, Dr. Lawson, for that kind introduction and for these framing remarks. I'm going to share my screen. Let's see here. Here we go. So I'm not a health expert, but I do study climate change and land use change as an environmental scientist. And I also have some understanding from my lived experience as a Lumbee person about the toll that these changes can take on Indigenous peoples. In my view, and for me, the communities I work with, there's substantial historical trauma that we continue to deal with. Climate change and land use change perpetuate that trauma and complicate it in some ways. In addition to the Lumbee tribe, I work with other North Carolina tribes, Kahari, Halawa Sappone, and I also interact with leaders and community members from the Occaneechi Band of Sappone and Sappone tribes, the present-day tribal nations mentioned earlier by Dr. Lawson. So Indigenous peoples in the United States and elsewhere have really deep connections to very specific landscapes and waterways. These connections are so profound that they actually inform our collective identities as distinct people. For example, I belong to the Lumbee tribe of North Carolina, and we come from the Lumbee River that you see here on the screen. The Lumbee River is one of many blackwater streams that drain the Atlantic coastal plain in what's now the southeastern United States. They're called blackwater rivers because the water from a distance looks really dark, almost black. If you look at it up close, it's tea color, and that's because of all the dissolved organic material that's naturally found in this water. And it stems from the fact that the river's flanked by these lovely wetlands, the giant trees that you can see on either side of the stream here. Our ancestors lived along this river and along other blackwater streams in the coastal plain since time immemorial. But in the early 18th century, war and disease and other colonial pressures forced us to leave behind much of our ancestral territory. But the Lumbee River was a safe and isolated place where our people survived and also thrived. It's not always an easy place to live. About a quarter of the Lumbee River's watershed is covered in wetlands. These are floodplains and other areas that are inundated with water for at least some part of the year. You can see on this slide the wetlands here. They are in blue, and they cut through the watershed. This shape is all the land area that drains into the Lumbee River. Along with wetlands, you can see croplands in brown, forests in green, and urban areas in shades of red. It's a really diverse river basin or a watershed. And there's a really delicate balance between land and water around here. And it takes generations of experience and hard work in order to live sustainably in this place that's a mix of land and water. So having said that, climate change is one of the large disruptors to the delicate balance between land and water that's made Lumbee people who they are. This graph shows temperature projections for the Lumbee River Basin that were extracted from global climate models. So using the 1990s as a baseline, it's easy to see that summer temperatures will increase significantly by the mid-21st century. So on this graph, the tan color is the baseline, the 90s, and the orange is the 2060s. And the increase is most profound in the middle of the summer. The July increase on average is at about 6 degrees Fahrenheit. And there are human and ecological costs to these temperature increases. They're not without cost. And there are cultural losses as well. So you can see on a couple of these images, the Lumbee River is still a place where we go to recreate. There are a lot of Lumbees who practice Protestant Christianity, and there's still baptismal services at places along the river where they've been held for centuries. Our largest cultural gathering, Lumbee Homecoming, occurs 4th of July weekend. It's already hot there, but if you add an average of 6 degrees to that, it's really gonna cause not just stress, but negative health impacts for people as well. We also know that climate change doesn't impact all places and all people equally. And one of the greatest tragedies of climate change is that the people who have the least capacity to deal with the negative impacts are often hurt the worst. And so here's a map from a 2017 study that was published in Science magazine that shows the socioeconomic inequalities of climate change. The red counties in the US are those that are going to experience the worst impacts of climate change. There are a few winners that you can see in green, but by and large, the nation as a whole is going to experience negative impacts, and they're not distributed equally. These counties tend to be lower wealth counties. They tend to have larger racially marginalized populations as well. And this is true if we zoom in and look at North Carolina in detail. So the authors of this study made their data freely available for anyone to download and analyze. I downloaded data just for North Carolina counties and grouped them by our economic tiers. So tier 1 counties, the ones in orange, are the most economically distressed in the country. And you can see that there's this strong negative slope in these counties represented by circles on this graph. And the Lumbee tribe is based in Robeson County. That's the top left circle on this graph. The lowest income, if you want to measure distress in that way, the lowest income of any county in the state, and also the highest expected costs with respect to climate change. And these are projected costs annually by the end of this century. I also analyzed these authors' data for changes in mortality to look a little deeper into health impacts associated with climate change. Here you can see the economic tiers, where red is that tier of most distressed counties in the state. And there's a significant increase or significant difference in mortality for the tier 1, the most distressed counties, compared to the other two groups, the less distressed counties. So people in these poorer, more economically distressed, and more vulnerable counties will experience greater changes in mortality as a result of climate change. Now, some of these are heat-related illness. Some might be related to storms, hurricanes, floods, things like this. I point this out because in North Carolina, tribal communities tend to be concentrated in these economically distressed counties. So Lumbees and other indigenous peoples are more likely to experience these types of negative impacts, including increased mortality on top of the cultural losses that come from having your homelands altered radically by climate change. In addition to climate change, Indigenous peoples in many places have to contend with land use change. Often land use change takes a form of deforestation, or in some places it could be desertification or coastal erosion. But for Lumbees and other Native Americans in North Carolina, land use change has a very specific look and feel to it. One of those changes that my group looks at is the conversion of rural cropland and other agricultural land to industrial livestock facilities. I know Sherry works heavily on this topic with communities in Eastern North Carolina, and this map shows us why. If you look at this map of North Carolina, the black spots on here are individual industrial livestock facilities, CAFOs, concentrated animal feeding operations distributed across the state. They're split up by swine, poultry, different categories, and there's a locus of these facilities in Eastern North Carolina, and especially in counties that align with tribes like the Coharie, the Lumbee, and the Waccamaw-Siouan, which you can see in that inset panel on the lower left, where the different colors represent counties where tribes tend to be centered today. Now, it's hard to understand the scale of these facilities. There's a few in the top left on this photo. You can see those long linear buildings, but it's hard to really get a feel for the scale of these facilities unless you see them up close. So here's a photo showing about 3 or 4 dozen of these sheds under construction all at once, just outside of a Lumbee community in Robeson County a couple of years ago. So these are really large buildings, but they're also a form of land use change. The buildings themselves are actually the size of multiple pixels that remote sensing scientists use to interpret land use and land use change from satellite imagery. These facilities also require the conversion of croplands into feed crops for the livestock as well. Recent news out talking about the use of atrazine and glyphosate increases as we convert croplands to these dedicated feed crops of corn and soy. So there are definitely health impacts associated with that, on top of the air quality and water quality impacts that come along with converting croplands into these buildings to raise livestock. We also have to understand that climate change and land use change are not independent of one another. And we see this every time that there's a major storm in the Southeast. We have flooding that tends to flood or inundate or otherwise damage and disperse waste from these livestock facilities all across the landscape. So climate change and land use change are really these intertwining factors that we have to look at together, not just in the Lumbee community, but in all communities in places like Eastern North Carolina, where we've got this, this dual threat from the expansion of polluting infrastructure and climate change. But in the end, I want to point out that for Lumbees and for many other Indigenous peoples, climate change and land use change together perpetuate the traumas of colonialism. Our ancestors were killed, enslaved, and displaced in order to exploit timber, fertile soils, land for livestock in places like the coastal plain of North Carolina. We've got to acknowledge the trauma, past and present, if we're going to move forward with sustainable and equitable solutions to issues that arise from climate change and land use change. Now, I'll leave you with this quote that talks about sort of the ethic of owning a place. There's more than one way to own a thing. Some of the most precious things we all own were not bought and paid for with money. That was a quote from a Lumbee leader who passed away a few years ago. And I think it's a good way to frame the way that we think about our river and about the other places that define us as a people. Thank you.
Thank you so much, Dr. Emanuel. Such a meaningful framing for us all. Next, we'll have Sherry White-Williamson.
Thank you. I'm going to share my screen as well. I have a short PowerPoint. Let me do that. Okay, great. Thank you for the opportunity to talk with you today. Dr. Emanuel sort of started talking about one of the things I'm going to cover in my presentation, but I want to talk a little bit about Conservation Network and what we do as an organization, because part of the big portion of the work that we do is forging connections with communities. And so I wanted to spend some time talking about what we do and how we do it, and then talk about one specific initiative that we've been working with some community leaders on for over a year now. The North Carolina Conservation Network is a statewide network. We are composed of over 60 different environmental community and environmental justice organizations across the state. And our focus is to protect North Carolina's environment and public health. And when I say we're composed of more than 60 organizations, I literally mean 60 different kinds of organizations. So you can say we have organizations from fishers and hunters or folks with that kind of interest to environmental justice communities who are on probably the far opposite side of the spectrum. So in order to do our work, we have a lot of oftentimes competing interests that we need to consider in order to reach our mission. And our vision is to bring these diverse groups together so that we can work on environmental policy decision-making at all levels of government, literally. Some of us work at the grassroots level, some of us work in state government at the legislative level, or at the cabinet level across state agencies. And some of us are beginning to focus more on work at the federal level. So we are doing all kinds of work, which entails bringing in all of the diverse groups that Conservation Network is composed of to reach consensus oftentimes on how we will approach much of the work that we do. And the way we reach our goal is to train, support, and organize, research, promote, and enact policy, develop clear and succinct messages, and engage North Carolinians. And I'm going to talk about each one of these individually. For the first one, for training and organizing, we actually have about a little over a year ago now, reached out to African-American and other community leaders in environmental justice communities to form a group to serve as somewhat of an advisory group to us. So these are 11 respected leaders from across the states, from the northeastern part of the state, from the southeastern part of the state, from the mountains, from the Plains area, and we are still working to expand that group so that it's representative. It is diverse by age, by race, and by location and interest as well. Through this group, we look to them to help us as we are developing many of pieces of our agenda to provide advice and recommendations to us, so that as we are thinking about our agenda as an organization, that we are making sure that those voices that are often left out of those decision-making conversations are included, and that we are able as an organization through our many partners to articulate those concerns as well, so that anytime there's a conversation around most issues, these leaders have been consulted in a manner of speaking, so that we can make sure we're relaying their message and empowering them, because often we don't want to be the voice without their being in the room. So we also make sure that they become a part of that conversation in the room as well. We assist partner organizations with research, and while today's discussion is about climate change, I wanted to focus on several other things that also impact climate change as we're having those conversations. We are working very closely with organizations on biogas. Biogas is a byproduct of the decomposition of the waste from hog farms. And it has become a real issue in the state now because it is being touted as it's converted from biogas to natural gas as being a renewable product. However, there are many questions about how harmful the production of biogas can actually be to the communities where these hog farms are located. And the byproducts that are produced could actually exacerbate many of the conditions in those communities versus making it better. Although the industry will try and suggest that this process reduces the amount of methane in the air, while not talking about all of the other byproducts that actually could create more problems. Dr. Emanuel already mentioned CAFOs. We've been working on that for some time now. PFAS is sort of a side issue, but for folks in Sampson County, it's a huge issue as well, because PFAS, Sampson County, where I live, has the largest landfill in the state. And PFAS that has been collected from other places has been disposed of in Sampson County. And there has been research on the waterways here, and there have been evidence of PFAS in some of the local streams where folks might be fishing and doing other kinds of things. Lead is a huge issue, and infrastructure is another huge issue that Conservation Network is working on with its partners. And that's also another important issue as we talk about climate change, because many of the communities that we work with, particularly the communities that live around these concentrated animal feeding operations, are on groundwater or private well water rather than on a municipal water system. And so when we have the storms that result from climate change and the flooding, that water is not safe and drinkable. And so in many cases, we have situations where families and communities are having to buy bottled water and keep bottled water in their homes because they cannot depend on being able to drink that water. So here we not only have a problem with climate change, but water is a human rights issue. And so we are trying to deal with that as well. And then finally, one of the things that we try to work on with communities and our other organizational partners is messaging. As we work with elected officials, messaging is very important, because if we don't have a unified message, then we are not able to effectively articulate to those members the rationale for their doing things differently. So when most recently last year, when the Farm Bill, the North Carolina Farm Bill, was being considered with the bad language in it to support creation of a general permit for anaerobic digesters, which is the process by which you get biogas from hog waste. We were talking very closely with not just the folks who were directly affected, but many of our partners to be able to advocate and to say to elected officials that there were many problems wrong with what they were proposing, and that it would have a devastating effect on climate, on the communities that live in those areas. And many of those areas are in floodplains. So the effect of biodigesters and hog farms is multiple in many of these communities. And again, I'll give you the example of Sampson County. Not only do we have poultry and hog farms here, but we have one of the 5 in vivo plants in the state. So that in vivo plant is deforesting areas so that they can provide wood pellets to the UK. But here again, now the local residents don't have trees that can absorb the carbon that we know needs to be absorbed. And there's nothing to slow down the floods or the damage from storms, because where there used to be a huge forest of trees, there's nothing. And it takes sometimes 100 years to actually grow another tree that's going to sufficiently provide the kind of protections that large trees produce in the area. So there again, another problem with climate change from a really local perspective. How do we do what we do? We work closely with partners to conduct symposiums, conferences, community meetings, and legislative visits. And I want to focus a little bit on the last 2. Community meetings from an environmental justice perspective are very important because many communities are not as active as many of us are with the legislature or keeping up with the kinds of proposals that are coming either from the governor's office or state agencies or from legislative members. And so we spend a lot of time in environmental justice communities, particularly assisting with or planning community meetings so that we can educate local community members to be aware of what is going on, because oftentimes the only way to get an elected official to pay attention to community concerns and needs is to be able to get those community members in front of legislators, whether it's locally elected officials or other decision makers. Without those voices, they are not heard. And we are constantly fighting to address the issue of climate change, because we see climate change in many of the communities that we work on a daily basis, because there are these ongoing issues that we cannot address alone. And the saying goes, it takes a village. It actually does take a village, because most of the communities, environmental justice communities in which we work, are either low income or communities of color, or perhaps both. And in all of those situations, those community members generally don't have access to the power structure in the community to be able to actually make change. So the best thing that they can do is to be able to talk with those elected officials and advocate. And so part of that process is working to build leaders that are comfortable, for example, with doing simple things like standing up in a local county commission meeting and advocating for themselves or for change. So that is a really big, important part of the work that Conservation Network does in its role as an environmental advocate across the state. And then one of the other things that Conservation Network does is also arrange for legislative visits. So if there are opportunities to get members of the public and particularly adversely impacted communities to get before their legislator, whether it be via a conference call or via Zoom or an in-person visit, so that we can start to help effectuate some of the change that we know needs to happen in these communities. And right now, as the Environmental Justice Policy Director, one of the big issues that we're looking at is environmental justice, and particularly as environmental justice is a large part of what the current Biden administration has committed to doing. And so we are looking at the infrastructure funding that is coming down to the state to try and advise community members of how they can engage and try to make sure that their communities get a fair share of funding to combat climate change, to combat poor housing, to combat elevated levels of death and disease, to combat the lack of appropriate health care, and all of the things that many of us take for granted in EJ communities. Climate change is a huge part of the impact of what happens, although when we look at environmental justice communities, it's not just climate change, it's so many other things. So as I talk about it, I look at environmental justice as sort of the umbrella, and everything else that we do impacts how a community thrives or does not thrive because of the way that these issues are handled. Climate change, we have been focusing on for a time. We continue to focus on climate change, but we're also looking at the other issues that affect climate change. We're looking at clean energy. We're looking at clean transportation. We're looking at affordable housing. We're looking at resiliency and recovery after storms, because too often in these communities, storms come, housing is destroyed, but the individuals living in those homes often are not the owners of those homes. And so they don't directly benefit from FEMA funds, for example, because FEMA is really set up to assist and replace property or repair property that is owned by the person, not necessarily living in the property. So climate change creates a lot of health related issues for us here that are not necessarily considered because of the type of populations that are here. So Conservation Network will continue doing this work, continue working with our Community Connector Initiative to make sure that we are aware of all of the various issues that communities have concerns about, and that we can, along with our partners, address them in the most appropriate way. Right now, the big issue for us is energy. And the state has a huge energy initiative right now. However, when the bill was passed at the state level, the language and protections for low and moderate income individual ratepayers was deleted from the final bill. So there are no protections right now for those ratepayers, and they would be the ones most adversely affected under the best of circumstances. But if we are looking at climate change and the disproportionate impacts, they would be the most disproportionately impacted. And so there was a lot of work going on to make sure that when the final plan for clean energy is considered, that those low income and moderate rate individuals are going to be considered in that process and added back into the process. But that takes work on the back end, which is one of the things that Conservation Network has to do, because most of these communities obviously would not know anything about the Utility Commission or how it works, and yet it's important that their voice be heard. So conducting educational opportunities or trainings so that individuals in those categories would feel comfortable speaking to the Utility Commission or writing letters to them to make them aware of their concerns and hopefully influence what a final clean energy plan might look like. But again, climate change is huge for this community, and it's huge for this community not because of just one thing, but because of all the things that most environmental justice communities are already facing, and to have climate change as an additional impact on top of all of those things just further exacerbates everything that they have to deal with every day. And with that, I will stop, and I look forward to responding to any questions that anyone has. Thank you.
Thank you so much, Ms. White-Williamson. That I really appreciate you highlighting the many aspects and the complexity. And yes, we look forward to further conversation. So with that, we'll hear from Dr. Annemarie Walton.
Thank you. I'm going to go ahead and share my screen. Okay, great. I won't be able to see you while I'm making this presentation, but I also encourage some questions at the end. So unlike the previous presenters, I want to just begin by mentioning that I don't have a lot of educational and formal training in climate change or in climate change education. And so I want to tell you a little bit about how I got to this place. So I am an instructor for and the facilitator of core course for our master's students called Population Health in a Global Society. And we see about 300 master's students in nursing come through this course. So these are all practicing nurses who are taking this required course, which is really focused on social contributors to health and disparities in health outcomes. But what I realized pretty soon after teaching this course is that we really didn't include the concept of planetary health within this course focused on population health and social contributors and equitable health outcomes. And so it was important to me to put some information in the course about planetary health, which really focuses on the sustainability of our civilization and the toll that inequitable, inefficient, and unsustainable resource consumption has on the planet and human health. And so what fits so perfectly into a course that's focused on these social contributors is that planetary health really examines these upstream factors, these political, economic, and social systems, and by its nature calls for an interdisciplinary approach to solving some of the biggest problems in planetary health. I include here at the bottom of this slide a memoriam.
Annemarie, I'm sorry to interrupt you for a second.
Sure.
I think that your screen share didn't work, so.
Oh goodness, thank you for letting me know.
Sure,
Okay.
sorry.
Gosh,
Maybe we need to just.
let me share screen too. Can you see now?
Yes, we're good now. Thank you.
Okay, I'm so sorry about that. Thank you for interrupting me. I couldn't see you. So I include at the bottom of this slide a picture of someone who really changed my thinking and influenced my training, and that is Dr. Steve Wing, who taught social epidemiology at the UNC Gilling School of Global Public Health. And it was in between, so I got a master's in public health, I was practicing as a nurse, and I was thinking about going back for a PhD in nursing, really focused on, as was mentioned in the introduction, pesticide protective behaviors of Latino migrant and seasonal farm workers. And I took his elective while not matriculated as a student anywhere. And he really shifted my thinking about the importance of not only involving communities, but having your research questions defined by communities, not only gathering data as a researcher, but teaching community members to gather data, being an advocate. And so he really, really shifted my thinking about how to be a researcher, and also encouraged me to explore this idea of environmental justice, which was the first that I had heard of it. And he was very active in, local to us here in Durham, over in Carborough, the North Carolina Environmental Justice Network. And I would encourage you, if you haven't explored their website or their resources, to take a look at that as well. But as I was mentioning, my goal was really to influence, incorporate more planetary health concepts into this course focused on population health. And so I was looking for resources and came across the Nurses Climate Challenge. So this is a global initiative that's delivered by Healthcare Without Harm in partnership with the Alliance of Nurses for Healthy Environments. And its goal is to mobilize nurses to educate themselves and other health professionals about the health impacts of climate change. And that seemed like a really perfect place to go for resources, to be educating practicing nurses who were working on a master's degree in nursing. There is a Nurses Climate Challenge in the US, one in Europe as well. And the one in the US was launched in 2018. Its goal is to educate 50,000 health professionals about the impacts of climate change on human health by 2022, and that's their website. You've already seen this slide today. Dr. Lawson shared it with you in her introduction, but we use some of these slides. This one is by the CDC, but also on the Nurses Climate Change website. And we use some of these to talk about planetary health and its impacts, and climate change and its impacts in our course on population health. In fact, one of the things that we share with our students is that the Lancet Commission identified climate change as the planet's #1 public health threat of the 21st century. And I think that's really surprising to students. One thing that we see a lot as nurses, and I think it's very easy for practicing nurses who are coming into this course, maybe not having been in school in a while, are the impacts of respiratory allergies and asthma and malnutrition, cardiovascular disease. Practicing nurses are seeing this every day, but they're focused kind of in this outermost ring and not thinking about some of what creates these adverse health outcomes to occur, and specifically to occur at disproportionate rates in some of our communities. So this course helps them take a deep dive into what some of those root causes are. It also helps them to think about populations that may be more vulnerable to some of these effects. So infants and the elderly, people who are living in poverty, those without homes, people who live and work outdoors, or who have chronic physical or mental conditions. So this is one of the resources that we use in the course. We also talk a little bit about where we live and work. And so I didn't mention this, but the course is asynchronous. And so our students, our master's students at the Duke University School of Nursing, there are about 700 of them, and they are all across the country. And so we give them an assignment where we ask them to take a deep dive into where they live or work and look at the air quality, the water quality, and compare that to the state and the nation. And then to talk about the intersections with equity, social justice, and environmental health. And you can see here, this is one of the Nurses Climate Challenge slides, that here in the Southeast, we are plagued by pretty much everything but wildfires. So for those who are right here in the Durham area, this is usually very influential to their thinking to start to really dig deep on what issues are here in our environment. Where we spend some time in our course is really talking about how healthcare contributes to climate change. So I think as nurses, we see ourselves as part of systems that are trying to help, but I don't think we realize how much healthcare itself contributes to climate change. And this was new learning for me as well when I began to engage with the Nurses Climate Challenge. So specifically, the healthcare system in the US contributes 10% of US greenhouse gas emissions. And we can talk about some of these gray clouds here on the slide. So hospitals are the second most energy intensive facilities in the country, and they use 2.5 times more energy per square foot than other commercial buildings. Hospitals are ranked as the third most water intensive public buildings, only after senior care facilities and hotels, and use an average of 570 gallons per staffed bed per day. Water is also a major contributor to greenhouse gases because we need energy to distribute it, to treat it, and to heat it. We serve a lot of food to our staff, to our patients, and to our visitors. And since an estimated 14.5% of global greenhouse gas emissions come from the livestock sector, we can make a huge difference in hospitals by serving less meat. US hospitals generate 29 pounds of waste per patient per day in the hospital, and the manufacturing processes and transportation of the products that we purchase in hospitals create 32 pounds of waste for every pound of product manufactured. We have students here in the School of Nursing that look at the impact of waste anesthetic gases as well, and we think carefully about how far even we as nurses and healthcare professionals are living from the hospitals and how we're commuting to work. So there's a lot to consider here for nurses, maybe for the first time, about how being part of a healthcare system can also contribute to climate change issues. So this was also very striking to me when I first dug into some of the resources, and we share this with our students, that the Nurses Climate Challenge offers. But if the United States healthcare sector, just the healthcare sector, were ranked as a nation, it would be the world's 13th largest emitter of greenhouse gases. So emitting more greenhouse gas than the UK, and just behind all of the greenhouse gas that South Korea emit. So this is really eye-opening and startling, and I hope helps practicing nurses think about some of what's happening within their own facilities while they're undergoing their master's here at Doosan. We encourage them to engage beyond the classroom. So we've worked with Rebecca and her green team here at the School of Nursing to ban distribution of single-use plastics throughout the School of Nursing. I shared this little flyer here on the bottom. During the height of the COVID-19 pandemic, one of the students in my course said, we're doing so much gardening, and gardening is such a great climate change solution. So together with the folks at the Doris Duke Gardens, we put together a webinar on how to utilize gardening as something that people could do as a climate change solution, both individually and in communities. We are supporting students to be Annie Climate Fellows. That's again the Alliance of Nurses for Healthy Environments, and linking nurses to some of these national groups like Annie, the Nurses Climate Challenge, Practice Green Health, with which Rebecca is involved, in Healthcare Without Harm. I'll show here, speaking of Practice Green Health, just a couple of these opportunities for nurses to be engaged in the facilities in which they work. This is a picture of the rooftop farm at Boston Medical Center, a picture on the bottom about Montefiore, that's in the Bronx, their Plant Strong program to reduce the amount of meat consumption within their hospital and thus their impact on the environment. And then nurses utilizing the surgical wraps to make sewing mats for the homeless. So there are things that can be done on a small scale and a large scale within healthcare systems that can really make a difference. And so our goal within the School of Nursing and in this core course is to help nurses think for the first time potentially about the impact that the healthcare sector has on climate change and some changes that they can be making within their own institutions, as well as some of the factors that impact the health outcomes that they are treating in their healthcare systems. So I'll go ahead and stop sharing and turn it back to the panel.
Thank you so much to all our speakers for taking the time out of their day to help educate us and enlighten us on not only the issues we are experiencing with climate change and the effects of it on human health, but also some solutions. We have a question from Elizabeth directed at Annemarie, and if any of our other speakers would like to chime in and put in their 2 cents, I think the diversity of answers is going to make a more robust educational opportunity. So her question is, would you discuss how the healthcare industry is responding to these numbers? And if you could go into more ethical questions that might be part of the discussion, i.e. some of these issues are life-saving, I assume, not being in the healthcare field. So I assume that's the whole debate of sustainability versus life safety in hospitals, having and needing single-use plastics for infectious disease control. Annemarie, if you don't mind, I'm going to take on the first part of this question. So there is a link in the chat for the National Academy of Medicine is leading a global grand challenge on the decarbonization of the US health system. And we're very fortunate, excuse me, at Duke, that the president of the National Academy of Medicine is actually the previous chancellor to the Duke health system. And this past year, we've had a master's group of students from the Nicholas School conducting a greenhouse gas analysis and creating a sustainability recommendation roadmap for Duke Hospital. So there is a huge national movement right now to decarbonize the healthcare sector, practice healthcare without harm, and really utilizing the health expertise of healthcare practitioners to help improve the health of their communities.
Thank you for sharing that. I was going to ask you to share for the first part of the question as well. I knew that was an area where you had some expertise. One thing I'll say that I think is happening in the healthcare arena in response to some of these issues, and a lot of my research dovetails with PPE, personal protective equipment. And so you can think about the amount of waste that's generated by the use of personal protective equipment. And so there are certain situations where we can't be without it. So in some of the work that I do, I really focus on anti-neoplastic drugs, which are very, very hazardous to healthcare workers. They can cause adverse reproductive outcomes and increased risk of cancer and those kinds of things. And PPE in those situations can't be spared. But when we think about routine vaccination and putting on gloves, using a set of gloves every time that we give a vaccine, that may not be needed. And so there's some recent research within and outside of the Duke University School of Nursing. I see Amy on this call, and I know that she was part of it with some of our ABSN students, but one of the projects here at Doosan was to give all of the flu vaccines within the School of Nursing and to everyone they vaccinated without gloves, and to get feedback from people about how that felt, having a practitioner touch you without gloves, because in fact, it's not really needed. And so it's a waste of PPE, and it's negative for the environment. So we are starting to see a shift and a more critical examination of how important or how exactly how PPE use contributes to some of the waste in the healthcare environment. So that's one way, one small way that we're starting to think about where can we save, where can we repurpose, where can we, and certainly during COVID-19, even in oncology, which is where I practice, we shifted some of our PPE use guidelines to be able to have more PPE for where it was needed the most. And so that's helped us all, now that that genie is out of the bottle, to take a critical look at how important it was to use everything that we use to protect ourselves in the first place. So those are some of, I think, the ways that we're trending and heading.
And I'll just chime in here. As it related to COVID, there were many concerns about waste disposal, because most landfills are still in communities of color or low income communities. And so there has been a huge effort to try and track waste to make sure that the contaminated waste doesn't end up in places like that. In previous years, there have been communities such as in Spartanburg, South Carolina, where used hypodermic needles and other hospital supplies have been found in open landfills, where children or other people could potentially be harmed, either, temporarily or fatally as a result of being in that area. So there is still an effort now within many communities to try and figure out where that hospital waste is going and how that waste might impact local communities. The most recent effort was begun by a couple of communities here in North Carolina, looking at where the waste from COVID, from PPEs and other types of things were going. So that's always something to keep in mind. Some of my Duke students, year before last, there was a plastic bag initiative in Durham, and they decided to trace where their trash was going and discovered that it was coming here to the landfill in Sampson County, and were very surprised. So we all need to be aware of where that waste is going, regardless of where it comes from. You might actually be surprised that it ends up hundreds of miles away from where you actually live, and impacting a community that may already be highly impacted by high levels of different types of illnesses.
I will only add that without belittling at all the criticality of water and energy to healthcare systems, it's important to remember that these entanglements between fossil fuels and the energy that they provide to hospitals and unsustainable sources of water that we use in the healthcare system are regularly used to justify the continuation of these energy and water systems. And I don't have the answer to that, but it's important to always acknowledge that we will always have that as a justification for why we need to continue to perpetuate these unsustainable practices.
Ryan, thank you for that wonderful transition. I feel like that's a great follow-up for our last question of the day from John, is how current patient safety and risk reduction regulations, i.e. single-use product use, limits the ability of healthcare workers to pursue more sustainable practices. So talking about the justification of infectious disease control is probably one of those regulations and barriers. But if any of our speakers had more information or other thoughts, we'd love to hear them.
Rebecca, I know the thing that comes immediately to mind is sort of your work with the single-use plastic liners in even the drink containers. I don't know if you wanted to talk a little bit about that, which is not necessarily PPE, but I think we're trying to find ways to move away from some of these, not only single-use plastics, but other single-use products. Did you want to talk a little bit about that?
Sure. I think if we're able to kind of frame the solution, even if it's a reusable solution, if you're able to frame it in a sense that it still meets life safety requirements for infectious disease requirements, and it actually improves the quality of care and patient experience, I think is the most motivating factor. If healthcare leaders hear this could improve the time that nurses have on the floor that's not spent getting single cups of water for each patient 5 times a day, if you can make the case that it's going to make a more comfortable stay for your patient, and they have to and they can avoid what we call moral injury. So patients that come in that have sustainability or reusability ethics are then in an unsustainable place with a lot of disposable options and materials. It can weigh on them emotionally. And when you have a patient in the hospital, you want them to be as healthy, happy, relaxed as possible. And if you can just make that case that it will improve patient care and their experience at the hospital, healthcare leaders really tend to listen to that kind of framework. And we're at time today, so I don't want to take up more time on everyone's calendar, but I really, really want to thank our speakers and our attendees today for a wonderful discussion around the issues, and then following up with those wonderful solutions. The solution-based aspect is a conversation I feel like we should have more of these days. And if you're interested in speaking more with our panelists, I will send a follow-up email with their emails and contact information. Thank you all so much for your time today.
Dr. Walton, could I ask you a quick question? And I won't take up just but a minute. I didn't catch when the conversation was going, and thank you for answering my question to that people answered it, about disposable needles. Where can I find out more about that? Because especially, yeah, did I hear right that there is some like group or something who is considering that, or maybe
So I am, and this may be, I don't know if Dr. Lawson knows anything about this, or Rebecca, if you do either. I am not as well versed in like needle